Why Black Americans are more likely to die with coronavirus. Black people are being infected by COVID-19 in greater proportion as compared to white in the United States of America. In a latest study, according to public health researchers, data of different states and big cities shows the comparison of white and black people infected by the coronavirus. But some of the cities are not showing the difference of color as they are showing the number of patients only. Even then, the available data shows a major difference that which community is being more infected by the coronavirus in the United States. Experts says, it is found that the ratio of black community affected by coronavirus is greater in number or ratio. There is alarming situation in different places and there is need to work more in these areas. If we see statistical data of different states and patients, we may conclude the results about African American community. Please don't forget to subscribe our channel. Press the bell icon to subscribe our channel. If we see the situation of Chicago, we may observe by statistics that African Americans are affected in double ratio as compared to other communities, and this is not a good sign for black people. If we see in different states such as in the state of Louisiana the population of black people is 32% of the state's population. But if we see the statistics of the people who died by coronavirus, it shows that more than 70% were African Americans. In an interview, Lady Mayor said that these statistics were the most shocking things she had seen as mayor. In the area of Illinois, nearly 43% of patients who have died from this disease, and the data shows that 28% of them who were being positive in the test, are African Americans. If we see the situation of Michigan, where the black community is only 14% of the total population, but the death ratio of these people is 40% of the patients affected by coronavirus. Situation in Louisiana shows that about 70% of the people who have died with the coronavirus is black community. Affected people of black community in North Carolina and South Carolina also have positive reports in tests for the virus as compared to white people. In the state of Minnesota, infected people of black community have approximately proportionate rates to their percentage of the state's population. Health experts say, the black people did not start to stay at home as they were instructed by the authorities, and the result is that they are at high risk now. One of the factors that makes COVID-19 is more devastating for the black community is that they experience high levels of stress-mediated wear and tear known as weathering. They face different kind of stress. Stresses like exposure to toxins, lack of sleep and racial discrimination. According to WHO, if a person is already a patient of asthma or other chronic lung problem, or he is a patient of diabetes or heart disease, the virus can affect him more as compared to healthy people. As African Americans have poor environmental and economic factors and they have higher rates of those illnesses, therefore the virus is more dangerous for them. This is one of the reasons that this community is suffering from this virus, as compared to other communities. A report of CNN says that black Americans have more issues of medical, they have less access to health care. They work in unstable jobs and sometimes they have to face the racial problems, therefore they are being affected more than others by coronavirus. Experts say that there are some reasons why the black people are being more affected. 1. Generally the African American community lives in counties in different states, as they live in groups, therefore they are affected by the coronavirus. 2. The black community does not care more about their health as compared to white people, therefore they suffer with the disease. 3. They did not follow the instructions given by the government for their own health, which is also a reason. 4. They already have some of the health problems such as diabetes, chest infection or asthma. This is why their death ration is greater than other. 5. They do not have social distancing with each other and the coronavirus spreads among them very easily and speedily. 6. Sometimes they have to face job issues and racial problems that causes stress. This stress reduces the immunity against disease. When the virus attacks on a person having low immunity, it harms him and the recovery rate becomes slow for such a person. 7. One dangerous thing is that if a person is affected with the coronavirus and he does not go to hospital for the treatment, he is a virus carrier and spreading the virus to other people. President Trump acknowledged the growing signs of disparity, and said that federal authorities were working to provide statistics over the next few days that might help examine the issue. He also said, "Why is it that the African American community is so much, numerous times more than everybody else?" Stay tuned with us for upcoming more cool videos.